The youngest patient that I've ever treated was a 11-year-old female, okay? So this particular patient unfortunately had little accident at school where she knocked her front tooth off. So because of a young age, we have to replace the missing tooth with an artificial tooth in the form of a denture. Hi, I'm Dr. Tan Kian Meng. I'm a prosthodontist, a dental specialist with Specialist Dental Group at Mount E Orchard. I will be speaking on the prosthetic replacement of missing teeth. What are your options? So in general, we have three options to replace missing tooth or teeth. The first one would be dental implants, the second one would be dentures, and the third one, we call it bridges. For dental implants, it's basically an artificial tooth root that is made of titanium. And the advantage of it is that it works very much like a real tooth. The second option, the dentures, basically we also know it as false teeth. It's something that you can actually remove and insert on your own. And lastly, bridges will require two good neighboring teeth to replace the missing tooth in the middle. And hence, we have a saying, it bridges the gap in your smiles. So how do we determine which option is the best? We would like to have an examination of the patient to determine if the patient's teeth and gums are in the best condition. We will also examine the patient's health. For implant to be successful, patient's health is important. Some patients will prefer dentures because of the ease of cleaning. And for bridges, it's fast because surgery is not needed. Dental implants is preferred over the other two options because it resembles our natural tooth. And with that, it gives you comfort, it's stable, and it functions very much just like your natural tooth. Apart from that, dental implants also preserve bones. It reduces the bone loss, and also it is meant for a long-lasting replacement. We are very lucky, to have great materials. For dental implants, we are using titanium, which is very biocompatible to our human's body. It's also very low in allergic responses. As for the tooth replacement, zirconia is a brilliant material to be used as an implant crown because it is highly aesthetic and has good strength. So for the ladies who are out there, you know zirconia is also used as an artificial diamond, so it's really strong. We also have a lot of digital advancement in dentistry. For example, digital scanning, we have CAD/CAM, we have CBCT, which is basically a cone beam CT scan, and all these aid in the planning and execution of implant dentistry. So to get an implant, it's not as long as what you think. Basically, we need from the start to the end is about 3 to 4 months, which includes the first visit. What do we do in the first visit? If there's a broken tooth or a tooth that needs to be extracted, that will be done. And on the same visit, actually, an implant can be placed into the extraction site. All this planning and execution can be done in a single visit. We need about 3 months for the implant to fuse with the bone. This is to allow a process called osseointegration. Once the implant fuses with the bone, then the dentist will make an impression of the implant. That will constitute the second visit. 2 weeks later, on the third visit, the implant will be restored and connected with an implant crown. So all in all, the fastest you can get an implant crown would be in 3 visits. So for implant dentistry, we need to be aware of some of the risks and complications associated with the treatment. The main thing about implant is that the success rate is 95% and above. There will be about 5% of failure is due to the lack of osseointegration, basically the lack of fusion of the implant to the bone. The second complication that can happen is when the implant is not placed at the correct position and angulation, and hence this will create poor aesthetic outcome. And With implants is successful, individuals need to maintain these implants very carefully, just like their own natural teeth. If not, there will be an infection around the dental implants, and you will lead to bleeding gums and swollen gums. So to maintain your implants, you will need two things. One is the professional care, the second one is the home care. For professional care, we would advise the patient to visit your dentist twice yearly. Okay, this would include the checkup on the teeth, the implants, the gums, to make sure they are all in good shape. If there's any problem, it would be good to pick them up when the problem is small. For home care, we would encourage patients to treat your implant as though you are treating your natural teeth. That would mean brush your teeth twice daily and brush it for 2 minutes. If you can, floss daily. Tooth loss is known to affect one's chewing ability, speaking, as well as appearance. And all these will affect one person's well-being. Replacement of missing teeth is known to sort of improve all these aspects. If you want to find out more how to replace missing tooth or teeth, please visit your dentist or dental specialist as soon as possible so that they can examine your condition and advise you appropriately.